So I'm going to get straight into it. A warm welcome this morning to our next speaker, Dr. Sue Sisley, the President of the Scottsdale Research Institute Field to Healed Foundation. Dr. Sue Sisley is a pioneering researcher who also served as a volunteer medical director for over 40 state cannabis industry operating licenses from Hawaii to New Jersey since 2010. Sue is fighting for quality, real-world cannabis samples to conduct clinical trials. She is best known for FDA-controlled trials with vets and first responders examining the safety and efficacy of inhaled marijuana flower for treating severe pain and PTSD, and recently published several articles on cannabis for opioid substitution with her team at the University of Michigan. Please welcome Dr. Sue Sisley. Her presentation today is titled Inhaled Cannabis for PTSD, What Does the First Randomised Controlled Trial Show? Welcome, Sue.
Oh, thank you so much. Appreciate you guys inviting me to talk today. I wish I could be with you. It's 110 degrees here in the Arizona desert, so I'm very envious that y'all are getting much better weather there. But we have a lot of really interesting material to cover today. So I'll just dive right in and start giving you guys a glimpse of what we've been doing out here at the laboratory. Let me take a look here. So first of all, as she said, SRI, Scottsdale Research Institute, is focused squarely on doing randomized control trials, looking at both smoked and vaporized dry cannabis flower for treating a variety of illnesses, but primarily our work has been examining whole cannabis for treating pain, PTSD, and also in the last few years, we've been looking at the potential of cannabis to treat opioid dependence, to see how the substitution of cannabis can improve lives. So, we have been at this for a long, it's been a long battle for us with our government. We've been attempting to focus our research on whole flower because we believe it's the best version of the plant, that dry bud is still the most popular in the US. It represents more than 50% of our sales in all these legal states. It also has the potential, if we can keep studying whole flower and putting it through the FDA process, it will set other precedents for other botanical medicines like psilocybin mushrooms, ibogaine, things like that. So that's why we're pushing for this. But also the overall mission of our work is to try to persuade insurance companies to pay for dry flower just like they would any other prescription medicine, to add that to their formulary. And so, yeah, that's why we're on this quest here. And you can see here, this was the very first study we ever did. This started over 10 years ago. This is the first randomized controlled trial in the world looking at cannabis as a treatment for PTSD. And as the title of the session said, what did this show? I'm going to give you a glimpse. And actually, I know we don't have audio here, but I wanted to just mention that this gentleman, Dr. Gupta, has been a huge ally for us as we've been going through the process of, trying to get this research underway. He's been very helpful in getting us organized. So I apologize you can't hear this, but basically that was right after I got fired from the university. They brought me on. I started going on this media tour talking about how our public universities are refusing to host federally legal cannabis research because they're so afraid of the radioactivity around the word cannabis. And that's improved a bit. We now have many more mainstream universities that are doing this work, but it's still a heavy lift. And this is why you can see I created this schematic so you guys can see all the regulatory hurdles that we have to go through in order to do a simple cannabis controlled trial. You can see each one of these boxes represents different agencies that we have to overcome in order to finally get to start recruiting study subjects. So you can see why it's so hard to get physicians or any scientists to do this research, because when they look at this, how daunting these layers of government red tape are, they wonder, why should we even embark on this? You know, they feel like they might not even complete this during their lifetime. So that's why the study that you just saw, the first veterans trial, took us almost 7 years to complete, and that's just unconscionable. But I'm going to jump right to the end, to the results of the study, and just let you know that sadly this was a negative study. After all those years of struggle to get the study finished, it turned out that our result, after unblinding everything, we discovered that inhaled cannabis was only slightly more effective than placebo, which means it's a negative trial, because you can't you can't just beat placebo. You have to beat it sufficiently in order, in a statistically significant way. And you can see down here the results. You see how the high THC, the arm of the study, this was high THC flower that the veterans were inhaling. It clearly did better than placebo, 44% versus 35%, but not enough given the statistical power of the trial. That wasn't enough to give it a positive, to declare it a positive test. So obviously we were all devastated, because we really wanted to help the veterans make this argument, while at the same time we have other studies like this. Our colleague George Greer in New Mexico had published this was an observational study, but the point was that this study used the same outcome measures we use, the CAP scale, which is the gold standard for measuring PTSD severity, and they documented a 75% reduction in PTSD severity with whole cannabis. They were studying patients who were using real world cannabis in the New Mexico program. And you just see how disappointing this is, that I can't achieve a 75% reduction in PTSD using conventional medications. And the fact that they were able to document that with real world cannabis flower is very impressive. And here's another really important trial that came out of the state of Colorado. This is, again, our colleague, Dr. Bob Miller. He followed 150 subjects using, these are PTSD patients using real world flower, and he documented a dramatic reduction in PTSD severity using real world flower. So I bring this up because I want to explain and make sure that you guys are aware of why we're not allowed to use real world cannabis in any US studies for the last 52 years. The University of Mississippi has enjoyed a government enforced monopoly on the only federally legal supply of marijuana for all clinical trials in the US. And so you can imagine how complicated. You can see on the one side is the cannabis that we get from the government, full of stems, sticks, leaves, seeds. And then the picture on the right is, of course, the flower, the intact buds that we desire to study, but that's not what we've been getting from the government. And we worry that that's what's sabotaging our outcomes. You can see here, this was my very first shipment of cannabis from the federal government almost 10 years ago. It comes frozen. It's been sitting in the freezers of our research triangle sometimes for many years. And here is the only information that you get about the cannabis. You don't know anything about the properties of how it was grown, what was done to it. All you know is the CBD to THC ratio is the only thing they record on there. And this is what it is when you pour it out of the bag. The veterans said it looked like lawnmower clippings. They didn't even recognize it was cannabis, and that's a real problem. So I'll show you, here is the only paper that comes with the box is this document that really has no serious information on it other than this warning that says that this cannabis is contaminated with fungus and bacteria and should be irradiated prior to using. So that was pretty discouraging, to see this. You guys know these are the trichomes that secrete all the medicine in this plant, right? They're full of all the cannabinoids and terpenes and these beautiful trichomes. I wonder if they even exist in the government cannabis. What happens is the government forces us to, pulverize this material into this sort of green powder. And, you got to wonder if there's even any trichomes left after it's been decimated like this. And so that's what what the veterans have been concerned about, is that this material, this is an actual piece. I know you're not gonna be able to hear this either, but I wanted to just show you that we've had a lot of good allies at Vice News that have been attempting to, to tell this story. Like, we've been showing them the pictures. I don't know if you can see the pictures of the flower, and trying to expose the fact that this is what the government gives us to work with. So it's pretty frustrating. Let me move on. So, you can see here that the concern, of course, for other countries outside the U.S. who rely on studies from our country, is that our studies seem to have been undermined by this low quality flower. That the reason we're not able to demonstrate we're not able to replicate the transformative experiences that people are describing in the real world, because when you're forced to use this material, and keep in mind that our studies issue the cannabis by weight. So if a veteran in the study was getting 2 grams per day of cannabis, think about half the weight of that powder is stems, sticks, leaves. It's not the dry flower. It's a lot of that extraneous material. So that can easily sabotage a study, because what happened is, in the trial, the veterans often needed 10 to 20 inhalations of flower in order to even to achieve any therapeutic effect. And when veterans are using real world cannabis flower, 15 to 20% THC flower, they report that they only need, sometimes just 2, 3, 4 puffs, and they already feel some pain relief, some relaxation, things like that. So that's why we are concerned that this may have, undermined our data, the quality of this material. So let me see. I think, and I just want to point out that the government actually forces us to hold them harmless. So in order to get my study drug, I had to sign this contract, which says that I accept all the liability for this cannabis, and the government cannot be sued over this. Only I can be sued if a patient has a adverse event. So I thought that was pretty fascinating too. So anyway, yeah, that's what we're up against, is, the question of, all of these cannabis trials. If you think about thousands of studies that have been done in the US, all being forced to use this material. The good news is that we finally did win our case. I'm going to see if it'll let me show you. So we sued the government in federal court for years, and we finally won recently. Let me see if I can pull that up. We actually got the federal government to issue us our own manufacturing license. And let's see if it's in here at all. Let's take a look. May not be. No, I'm not sure if I have it here. Oh yeah, here it is. Let's see if it'll come up here. So here you can see, this is my dog Dodger, and this is our babies, and this is our whole flower. These gorgeous buds are going to be used in our next veteran study. We just got a $13 million grant from the state of Michigan to start a new trial looking at inhaled cannabis flower for both pain and PTSD, studying both in the same clinical trial. And we're really excited. And, and that's why I want to encourage you guys. Yes, it took us many years of litigation in federal court in order to achieve our own manufacturing license. We toppled over a 52-year-old government monopoly. And I think that it's important to use litigation whenever possible, because we spent years lobbying Congress and trying to, bring thousands of patients to the Capitol to bring all the, power of the public will, but it didn't do anything. In the end, the only thing that worked was going to court and finding a sympathetic judge who understood the absurdity of this monopoly and realized that this was an attack on scientific freedom when they're giving you, what the veterans would say, like garbage in, garbage out, like you're never going to get better results when you are using that. And so now our goal is to try to supply whole intact buds in the study, let the veterans grind up their own flower as they do in the real world, and let them have a better, at least level the playing field, because right now we feel like the playing field is not fair, and that's a big problem. So I think that maybe I wanted to just show you while I have you here. This is our next study. Yeah, let me jump to this, because I told Lucy I would touch on this piece here. Let's see where it went. Here it is. Federal right to try. Yeah, so what has happened is our federal government about 3 years ago made this into statute. So now this is the law of the land in the US that says any patient with a life-threatening illness can now petition a manufacturer like me and request investigational drugs. So since we're in the middle of FDA phase 2 trial, we're studying both cannabis and psilocybin mushrooms. We have a federal license to grow both of those right now. So what we're doing is we're trying to, let me see if I can actually make this larger. Hang on 1 second. Yeah, so here you can see that we're trying to make both of these materials, cannabis and mushrooms, available to not just terminally ill patients. The law actually says that we should be able to provide this material to anyone with a life-threatening illness. So that can be defined very broadly. A lot of veterans are thinking that they should be able to qualify, and I concur that if you have untreated PTSD or undertreated, the end result of untreated PTSD is suicide. Certainly should qualify as a life-threatening condition, but probably will end up having to be tested in court. We'll see. But I just wanted to make you aware of this, because I'm very proud that our government was able to pass a law like this, because our FDA is behaving in such a severely restricted manner that people with terminal illness who just want compassionate access to Schedule I drugs can't get it. They have to go underground, and that is really unfair. So this law was created to actually circumvent our FDA. So the only thing we're required to do under this law is file an IND application, just the initial, drug master file showing what's in this material, and then do a simple phase 1, which is just a safety study. It could have 20 patients in it. I could complete it in 6 months. I don't even have to publish the data. I just have to complete a phase 1 trial. So I think this is a really good workaround. I know our FDA vigorously opposed this law, and they still have, obviously very conflicting feelings about it. But The fact is the law exists, and we're gonna, as soon as we can, we're gonna start attempting to provide terminally ill patients with this material and start to test the boundaries of the law and see what is allowable. But yeah, I think that is really my whole the main points that I wanted to get across to you today. I don't know if we're capable of taking questions, but I thought, let me just see if I can get out of this and just see if you guys have any. I don't know, Nathan, if you think, is it possible to take questions, or should I just let them go on a break? Not sure.
Sue, we can absolutely take questions. So,
Oh, is that all right? Okay.
Okay, I'm just going to walk out into the audience and find the first person. I'm looking at you, Derek.
Okay.
Do you have a question? Not yet? Okay. Anyone else got a question? Come on. Here we go. Awesome. We've got a few. Terrific. All right, I'll start with this lovely lady. Hello.
Hi, Sue. Thanks for your time. When you're talking about smoking flower as opposed to vaporizing flower, are you talking about a similar grammage in the cigarette over a vape and using the flower in a vaporizer?
Good question.
Or dosage, I should
yeah,
say.
so yeah, in our case, what we're doing, we give the patients 2 grams of the dry flower in a canister. So they have, Monday, Tuesday, each day has a different canister. And in the previous study, we only allowed smoking, but in our next study, we're actually going to provide them both devices. So they'll be getting a smoking device, which, by the way, is a water bong. I don't know if any of you guys have seen these, but they're not typical of FDA clinical trials. So I'm very excited to be able to use a water bong in an FDA study. And then we'll be providing a handheld vaporizer device like PAX or Mighty Medic, one of those that we haven't decided which one yet. But then they'll have the opportunity each day to pick which one they want, because we're curious to see what choices they make each day. I noticed that some of the veterans say they like to just vape during the day, so they have sort of more of a light effect and they can go to work and be high functioning. And then they often like to smoke at night for more potent, more robust activation of those molecules. They like to go for combustion, but that's what we're hoping to learn in the next trial. So we don't know the equivalencies of, like the equivalencies of smoking versus vaping the dry flower yet, but we want to just see what choices people make and document all that so we can learn from the vets.
That was the next question. Sorry, I was just going to ask you, how do you actually get the quantitative data? Do you ask them to fill out a journal or to document their effects?
Yes, so they do have, they're required to fill out an electronic diary every day to help guide us on why they made these choices each day. And then what they do is they return, each week they come back to our lab, they return these, the unused marijuana from each day. So they'll bring back 7 canisters and we'll weigh the unused amount so we can figure out what they needed each day. I'll tell you, when we were using the government cannabis, almost all of it was getting returned. Of 2 grams, they might have used a half gram because it was so bad and it caused them so much throat irritation that it wasn't even worth smoking. So, but I'm curious to see what happens now that they're going to be getting real world flower, like a high quality, non-diluted flower. Do they choose to use more each day, especially if they're treating both pain and PTSD? I'd like to see how that works.
We've got another question here.
Hi, Sue. It's Beck from, formerly from Weeded Warrior.
Hey, Beck.
Hey. Great to see you today. And first of all, thank you for helping to take away some of the stigma around smoking cannabis. We still very much have a stigma around that here in Australia, and I think it's really great that you're actually doing some studies on smoked cannabis. My question is actually around psilocybin, and I'm wondering if you are talking about microdose psilocybin or high-dosed psilocybin in some of your research.
Oh, can you repeat that last phrase? It cut out.
Oh, I'm just wondering if you are talking about microdosing psilocybin or high-dose psilocybin in your research.
Yes. Oh, good question. Yeah, we're starting out only with microdosing because I'm just afraid with shipping out material to terminally ill patients that I'm not following long term. I'm nervous. I don't want to create, what you just said earlier about all of our efforts to reduce stigma around plant medicine. I'm terrified to send out a large dose to folks and then have them develop some kind of adverse event and then have it scar the whole program, So I'm thinking it's better if we just go with the micro doses. Then what we can do, if I'm sending out a week supply each time, I can at least I can rely on them. They can decide to coalesce the doses if they want and make a macro dose and work with a local therapist in their state. But this is such a tricky new territory. Nobody's ever supplied terminally ill patients psychedelics under federal right to try law. So we want to be very cautious about how we proceed and make sure that we don't give the program a black eye,
I've got another question here.
Hi, Sue. Yeah, I'm ex-Air Force and I'm sitting next to Derek, who's also ex-Air Force. He's worked more with cannabis. I've worked more with the psychedelic space. I was just wondering, how could you sum up sort of what the main benefits in the mind are for say a veteran with PTSD? Like, I know that psilocybin, they focus on neurogenesis and things like that, or work around the amygdala and that. And the second part would be with cannabis, when they come off it, is there any side effects, as in agitation or anything like that, or any adverse effects when they taper off or stop quickly?
Yeah, no, great questions, and thank you for serving. I think these are really important inquiries about, especially the part about the drug withdrawal. We purposely designed this last trial so that we could measure, we forced the veterans into an abstinence period where they had to wash off their previous cannabis before they entered the trial. And then there was a crossover part of the study. They might have been exposed to a high THC flower in round 1, and then they had to wash off for 2 weeks and go and cross over onto a totally different variety of cannabis, maybe a 1-to-1 THC CBD flower. So during those washout periods, we were able to document, how they tolerated that coming off of it. And it was a very mixed bag. For some folks who were getting a lot of benefit from it, they, of course, reported a dramatic increase in their PTSD symptoms, some of them even to the point where they got overtly suicidal. So that was very scary. And we just tried to give them a lot of wraparound support to get them through so they could be guaranteed, cannabis in the next round. But I think the hardest part was for people who got assigned to placebo in round 1, because then they were on nothing that whole time. They were on no cannabis and no other support. So it was really tough. But I do think it's hard to distinguish then, are they having a drug withdrawal syndrome from stopping the cannabis abruptly one day and then being abstinent for 2 weeks, or are they literally needing the cannabis to treat their illness and the cannabis was doing a good job, and then suddenly you stripped it away from them and suddenly the illness rears back up. So it's hard to distinguish what's really going on. And I don't think we'll ever be able to know that. But I think the bottom line is that what we did determine in the study, even if the efficacy wasn't very clear, was that this medicine is very well tolerated. And even with smoking, that we had very few very mild adverse events, and they were pretty rare, even with the lousy material that we had to use. And I think with the psilocybin, I don't know, it's there. This is so exciting this time. We finally have ability to grow our own mushrooms. So I'm really, this will be our very first trial using the psilocybin in a safety. So we're doing a dose escalation trial where we're going to expose veterans to, a variety of doses and see what is the maximum they can tolerate before they start having, before they start tripping, before they get into these perceptual changes. So we're going to see, what's going to work out the best, and try to formulate that into something that's easy for people to tolerate, and just trying to, because you can see all over the country here, we have decriminalized movements, in different states are already way ahead and have already decriminalized this. But the problem again is, how do the veterans get this legally? Decriminalizing isn't sufficient, and veterans should be allowed to pick up cannabis or psychedelics through their VA pharmacy, just like any other prescription. That's the goal overall. And so I'm hoping that these steps we're taking with the science will help you guys get there. And hopefully now we won't produce any more negative data. Now that we're able to use good study drugs. So we'll see what happens. I feel bad because I don't want to monopolize the time. I know you guys probably have to move on to the next speaker.
That's okay. Thank you so much, Sue. I think we've answered all the questions anyway. Is that right? I'm looking out. There's no more hands up. But we would like I'd like to call for a round of applause, because you've been absolutely brilliant, and how lucky that we get to speak to you via the Q&A as well. It's terrific. What a bonus.
I loved it. Thank you so much. I feel like I'm there with you. I can see you easily with the system here, two-way camera. And I think I was going to mention, I am going to be on the panel later with the veterans, and I have some interesting news about the VA hospitals here embracing cannabis and psychedelic research. So I'd love to share. So I look forward to rejoining you guys in a few hours.
Terrific. We look forward to seeing you then. And I just have to tell you, you're not missing much weather-wise. People-wise, yes, but weather-wise, it's torrential rain here today. So there you go.
That gives me some relief. Okay.
Yeah, I thought I'd make you feel a little bit better. So thank you so much, Sue, and we'll see you in a couple of hours. Thanks again.
Thank you. Take care, guys. Bye-bye.